morning for everyone. And I'm Dr. Olha. I'm cardiologist, rheumatologist, internal medicine doctor with 25 years experience. And today my lecture will about the comprehensive strategies for heart longevity. But as a cardiologist, I would like to ask you, what is the main and most important organ in our body? As a cardiologist, I say that it's the heart, right? Because as for cardiologist part, the heart arrest, heart death means our organ is dead. But despite of the researches, despite of the development of medicine, the cardiovascular and also cerebrovascular diseases are still on leader position in structure as morbidity and mortality. How do you think what is the common for these famous humans? Everyone passed away due to stroke. And what is the common for these famous persons? Everyone passed away due to cardiac arrest. So the cardiovascular diseases is number one killer, especially due to atherosclerosis, of course. And what are the main risk factors for atherosclerosis? You know, it's the harmful habits, the smoking, alcohol consumption, it's obesity, diabetes, genetic predisposition, of course, hypertension, dyslipidemia, and new option like dysbiosis. So, as a convention doctor with, as I said, 25 years experience, I am not satisfied with results of convention medicine, because despite of many new molecules and many new technologies, cardiovascular disease is number one killer. So my question in part of convention medicine doctor, what eludes our understanding, and what can we do in part of bioregenerative medicine. So today I would like to talk about the bioregenerative approaches for cardiac longevity and talk about the main enemies of myocardial longevity, and also what are the potentials of bioregenerative medicine in treatment of cardiovascular diseases. So all cardiovascular diseases like myocardial infarction, myocarditis, hypertension cause the death of more than 1 billion highly specialized cardiomyocytes, which leads to the cardiac fibrosis, cardiac failure, it means the cardiac senescence. And I'm very happy as a convention doctor first, because even in convention medicine, the reason of all these cardiovascular events now shift to the main factors which eludes our understanding. It is systemic inflammation. And this year, European Society of Cardiologists guidelines already includes that should be detect C-reactive proteins, and if in case high level, we need to recommend our patient additional low dose of colchicine daily. You know that this medicine before was used for acute gout arthritis in rheumatologists, but now it's official recommendation in convention medicine. So I'm happy that we're focusing to some changes which eludes our understanding as a cardiologist part, and it is very important as a for senescence process, as a for cardiac longevity, because it starts from the inflammasomal formation, which releases the caspase-1 protein, that releases that protein gasdermin. This gasdermin causes the holes in cells membranes and leads to the mitochondrial dysfunction. And mitochondrials are the main organelles which produce energy for cells, especially in cardiomyocytes too. And for normal functioning of mitochondria, it is crucial the level of nicotinamide dinucleotides as well as the coenzyme sirtuin level. So the main enemies of myocardial longevity based on the mitochondrial dysfunction low-grade inflammation with releasing the pro-inflammatory cytokine, and also gut microbiome condition. Because in this biosis, due to releasing them also pro-inflammatory cytokine, it enhances the general inflammation. As well, the releasing the toxic substances of trimethylamine can kill the other brain cells, other cardiac cells, and enhance the vascular dysfunction, which leads to the atherosclerotic plaques growing. How we can interrelate the gut and heart? So, due to this biosis, it causes the leaky gut syndrome, which increases the permeability of enterocytes. This pro-inflammatory cytokine gets to the blood flow and causes the migration of monocytes. And this monocytes migration causes a microvascular injury of heart. And cardiologists are aware about how difficult to be treated the microvascular dysfunction when no any seriously coronary vessels obstruction, but patient have the ischemia. The inflammation are the termin of cardiac genital senescence, and we talk about the cardiac senescence, means not only pro-inflammatory cytokine, but also its disproportion between two main cells of immune system, M1 macrophages and M2 macrophages, which release pro-inflammatory, anti-inflammatory cytokines. And also M2 macrophages can help to clean cells from intracellular garbage. And what's the scheme of inflammation? It's very difficult to understand, but it starts from the inflammasomal formation, which activates the lipid peroxidation, also activates the receptors of low-density lipoprotein species K9. It's disproportion of macrophages, which leads to the accumulation of intracellular garbage, and this causes the damage association molecular pattern. This biosis with toxic substances, trimethylamine, which also cause the genomic instability, enhance the oxidative stress, telomere shortening, mitochondrial dysfunction. So it looks like a vicious circle. And how we can disrupt this circle? And very important is all this mechanism leads to the heart denervation. Heart denervation can realize with reduced heart rate variability, and also this denervation leads to the silent ischemia and lethal arrhythmia, and also autonomic nervous system, lose the autonomic nervous system control of regeneration cells. So what is the solution question? So first of all, of course, it's lifestyle modification. So we need to recommend smoking, alcohol cessation, then the decrease loss of weight, control level of glucose, hypertension, lipid profiles, gut microbiota condition, but also we need to calculate cardiovascular risk of our patient. Why it's very important? I say later, but also in part of recommendation, it's a crucial the normal diet. So for cardiovascular patient, prefer the Mediterranean diet, and also physical activity, at least 150 or better 300 minutes a week of moderate activity. And training and weight loss increases the peak VO2. A treadmill test, it was confirmed in the meta-analysis. But what can we offer for those who cannot afford physical activity? So we have invasive procedure you can see in our clinic, ACP. So what is the main mechanism of ACP? It's based on some methodics that the blood is supplying in diastole. So the airbags inflate during diastole gradually from distal part to proximal, and force flow back blood during diastole because it's synchronized in ACG, and this causes the blood supply of heart, and also can induce the growing of collaterals. And before systole, these airbags deflate and it decrease peripheral resistance. And decreasing peripheral resistance is the main purpose of treatment heart failure. And due to the improvement circulation, not only heart, but also other inner organs, some research was confirmed about the improvement even erectile dysfunction. So indication of the for treatment on ACP, it's angina pectoris, it's heart failure, it's rehabilitation after myocardial infarction, and also erectile dysfunction. Another option we can offer, it's a hyperbaric oxygen therapy, because they increase the partial pressure of oxygen. We can inhibit lipid peroxidation, can stimulate repair of blood vessels, promote new blood vessels growing, and activate own stem cells. Now discussing the new protocols of hyperbaric. So it's based on some principles of intermittent period of hyperoxia and normoxia. And we have also this special hyperbaric which supplied by the oxygen mask. And during this procedure, we can change the period of inhalation and breaks without the additional oxygenation. And this intermittent hyperoxia can induce the hyperoxia-induced factor, also can stimulate the stem cells, improve their level of sirtuins, and improve their mitochondrial function. So the daily session for this protocol up to 90 minutes and 20 minutes break after the period of high oxygenation. But if we have, why I emphasize about the calculation risk factors for our patient, which risk group of our patient, because we have some patient with a high risk group or very high risk group after myocardial infarction, after stroke, when we have to recommend the antiplatelet and statins therapy. So it's not enough only lifestyle modification. But the statins, despite of the positive effect, due to blockage of HMG-CoA reductase, they also can reduce the level through the mevalonate pathway, reduce the level of coenzyme Q10. Despite of the positive effect in clinical trials, the statins can increase the prognosis, good prognosis for cardiovascular prevention, some accidents up to 20%. But in part of the condition of mitochondria that can violate the functioning of coenzyme Q10. And what should we do? We need to recommend additional supplementation Q10, coenzyme Q10. But according to the researchers, it should be at least 200 milligram daily. Better to patients which have to take statin, it should be even up to 400 milligram daily. So it's a high-level supplementation of coenzyme Q10. Another bioregenerative product, it's phosphatidylcholine. It's precursor of acetylcholine. It has the many positive effects in our body, so it includes in component of cell membranes. As a precursor, acetylcholine can improve the neuroplasticity, also can maintain the lipid profile and improve the digestion. And also another bioregenerative product, omega-3 fatty acid, confirms that it can improve not only focused for cardiovascular death, but also death for any case. So it's evidence medicine. Did you know that the low level of vitamin D is associated with the cardiovascular diseases? And deficiency of vitamin D can influence to many dysfunction other system organs. Why? Yesterday I explained this mechanism, but someone was absent, so I repeat one more. So what is the main, one of the main mechanism? Protection of cardiovascular protection, vitamin D. Vitamin D is not final product. So our D hormone receptor can bind only with D hormone. D hormone is the calcitriol. But to get from this level, vitamin D, to calcitriol, vitamin D should pass two hydroxylation. One in liver, second in kidney, with help of alpha-1 hydroxylase, which can be released by kidney. And if patient has a chronic kidney disease with low GFR, so this is, it means the low level alpha-1 hydroxylase and vitamin D cannot be converted to the D hormone. So it activates the secondary hyperparathyroidism. High-level parathyroid hormone causes the bone resorption, and due to bone resorption, these salts and calcium salts can deposit to the media vessels, media layers of vessels, and cause the arteriolosclerosis or vascular calcification, as well as can cause the kidney stone disease. Another bioregenerative product, vitamin K. K1 vitamin mostly involved in coagulation, but if we talk about the cardiovascular, prevention of cardiovascular events, so we will talk about the vitamin K2 or menaquinone. Mostly it found from animal products, but recent research confirms that seaweed consumption due to the process of fermentation by microbiome can release the natural forms of vitamin K2, which can prevent the vascular calcification and also prevent the kidney stone disease. Why? Because the vitamin K2 helps to carboxylation glutamic to carboglutamic acid, inhibit of vascular calcification, and promote the bone mineralization. And this dietary intake of menaquinone is associated with a reduced risk of coronary heart disease in the Rotterdam study. So it's evidence medicine. But if we talk about the regeneration, so it should start from the cellular level. So the new perspective stem cells therapy open us the new opportunity in part of bioregenerative medicine. Dr. Simon talked about the brilliant the classification of stem cells and how they be divided. So I need to only mention that stem cells has the same age as a donor. So we need to think about it. And what the focus in part of bioregenerative medicine, this focus shift to the unipotent cells. So the high regenerative potential have the unipotent cells. If we dive in history of stem cells in cardiology, it starts from the skeletal myoblast. But in clinical experimental research, it have shown that they have had their high level of arrhythmogenicity. Other bone marrow stem cells and branch, the hemopoietic stem cells, mostly used in oncopathology. And most evidence we have with the side of experimental study with CD34 cells, also mesenchymal stem cells. Embryonic stem cells have shown the high level of teratomas formation. And induced pluripotent stem cells also have shown the positive effect in experimental study. And I would like to show these results of trials which focusing to improvement in experimental model about the focus of cardiac failure due to improvement of left ventricle ejection fraction. Many trials, and I'm very happy that the recent research, it was conducted as a clinical trial. It's a phase 3 DREAM heart failure trial. So this research achieves the endpoints of clinical trials. These precursor stem cell, mesenchymal stem cells can reduce the cardiovascular mortality and myocardial infarction and stroke in patients with chronic heart failure. So it's quite good results. But we need to be aware about some barriers to transplantation, like immunogenicity, engraftment, and arrhythmogenicity, and that is why I can repeat one more. The focusing now shift to the unipotent stem cells. Also, the new options in part of bioregenerative medicine, it's exosomes. Classically, the exosomes, it's like intracellular vesicles, and they can help communicate the organelles between each other, but when the cells can excrete these exosomes, it becomes like extracellular vesicles. That is why in different literature you can read other extra, other intra, so it depends on the stage. But the exosomes act as a vehicle which can carry the microRNA and proteins and lipids and other molecules. So the exosomes can be used as an early diagnostic marker to predict some diseases. And depends on the types of microRNA, we can suggest about the future pathology in part of heart, for example, and many studies about the different microRNA is as a diagnostic tools for prevention some diseases, very precise. And also clinical trials confirm that the exosomes which derive from mesenchymal stem cells can improve the condition of heart. I can underline one more, then depends on the which microRNA they can carry, because some of them can induce hypertrophy, some of them can inhibit cardiac fibrosis. So we have many opportunities and from part the bioregenerative medicine, but my opinion that we need to bring our knowledge conventional medicine and bioregenerative. So I would like to finish my lecture with a quote, the Lao Tzu, the most distant path begins with a first step. And as Frank Sinatra taught that I did it my way, so we have own way, we have the knowledge to move ahead. Thank you for your attention.
Thank you so much, Prof. Dr. Anha.